The state of Florida has been kicking sick children off of health care for the crime of being poor. Since January 1st, more than 22,500 children have been disenrolled from Florida Kid Care. Now, that is its version of the Children's Health Insurance Program, jointly subsidized by states and the federal government. So in Florida, this Kid Care requires you to pay a premium for it. Families who earn just above the threshold for Medicaid are eligible for the care, but again, are required to pay a premium. So now, the Florida income cap for Medicaid is $2,829 per month. Now, it is important to note that the cost of living in Florida is very high. It's actually higher than the national average, with research putting Florida at 15th highest across U.S. states. Wait a minute, I thought that it's a red state, supposed to be, a bastion for freedom and, everything to do with, hey, everybody can afford things because you don't have the Biden inflation or these, red states, these blue states, these blue-haired governors of Democratic states making it very expensive for people to live there. No, it turns out Florida is very expensive. It turns out that, you have to have, this is according to the Bureau of Economic Analysis, the average cost of living per person in Florida is about $4,224 per person monthly. So you have to make per person over $4,000 just to be able to live in Florida. And so, yeah, you have these, you have this cap that is $2,829 per month, meaning that in order to qualify for Medicaid, you have to be extremely poor in Florida. Okay, very, very poor. So it's not surprising then, and this is how it all ties in, that Florida officials have admitted that some of their disenrolling of these children are because of non-payment of premiums. So they can't afford to pay the premiums for the Medicaid. That means they're getting kicked out. Which again, they're being kicked out of a program that is only eligible to the poorest Floridians. So that's what's going on here. They can't afford it. Now the state says, though, we don't give a damn. And so they remove these people despite the fact that there is a continuous eligibility clause in the 2023 Consolidated Appropriations Act that took effect at the beginning of the year. That clause actually makes it illegal to kick any family off of this for a year for non-payment. In fact, the clause secures 12 months of cover if at least one premium payment happens to be made. So can't kick them off for a year. Now, last week, of course, DeSantis decided to sue, saying, we don't like that rule. They challenged the rule in federal court in Tampa, arguing that it makes CHIP an entitlement program that illegally overrides state law requiring monthly payment of premiums. Now, until there's a ruling, this still applies. This is still law of the land. But DeSantis has decided not to wait. He wants to kick the poor kids off right now, immediately. Cruelty, now. Not later, now. In fact, figures from the Florida Health Justice show that there were 5,552 removals in the month to April 1st, following 5,097 in March, 5,147 in February, and 6,780 in January. Florida argues that the numbers are like, we didn't kick all those kids off. I mean, yeah, some of them aged out or they moved into other coverage, and that disenrollment has been consistent at this level for years. Sure, some of those things do happen, by the way, aging out, going into other coverage. However, this is not an example of that. The monthly average so far this year is actually more than 1,500 higher than the whole of 2023. So it's not just the normal amount of disenrollment or, people moving on to different healthcare places. No, he's kicking the poor kids off of the healthcare and wants to hide it. Now, according to Democratic Congresswoman Kathy Castor, she has been contacted by several families booted from Kid Care or unwinded from Medicaid as COVID-19 protections expired. Quote, "Is this enormously cruel and a crisis of callousness by our governor and state of Florida, who are willing to sacrifice sick children for their political aims?" And their political aims, of course, are to give as much taxpayer money as they can to Ron DeSantis' corporate friends in the form of tax cuts and, deregulation and, bonuses, things like that, subsidies. It's an important reform for parents because once you qualify, you can stay on for a year. Your child will get the care they need, consistent visits to the doctor's office, and if they have a complex medical condition, they know it will be handled. Yeah, and if you make at least one payment, I mean, families are struggling, and this will allow them to at least come up with one premium payment so that they know that they're covered. That's something. Now, I still think that every child, every man, woman, child, by the way, should be covered regardless. Okay, I believe in truly universal health care, but stuff like this is a bare minimum, and yet you have Ron DeSantis trying to take that away. Cruelty. Now, getting back to Castor, she says that in the end, this saves everyone money. It saves families heartache when young children can stay healthy and well. But Ron DeSantis loves a lawsuit. Florida is the only state in the country that is so upset that children are going to get health care that he's suing in federal court. And I'm sure he won't be the only one to sign on. Castor said that one family she had spoken to had a 2.5-year-old toddler who was born 3 months prematurely, saying she is fed exclusively through a tube. She has extreme developmental delays and requires 24-hour nursing care, which all of that stuff is incredibly expensive. They said since birth she has faced challenges, including 5 months in neonatal intensive care, hernia surgery, ear tube surgeries, and seizures, and ongoing treatment. So now the state has ended her coverage. It's heartbreaking, it's cruel, and it's unnecessary. And by the way, if that child does not get that care, I mean, that child will die. 100%. So if you're in favor of kicking kids like that off of healthcare, then they die. That's what happens. There's no option here. There's no option to, they could get healthcare or not. Well, if they don't, they die. That's the option. They die. Let's be very clear, right? So now, some will argue, why don't the parents just pay the premiums then? Well, I already talked about how cost of living in Florida is way more, pretty expensive, all right? But all that other stuff also costs a lot of money, all that healthcare stuff. Plus, there's the other things that nobody thinks about. Like, for example, if you're constantly having to take your kid back and forth to, appointments in order to keep them alive, are you going to be going to work? Very likely your work life is going to be impacted as well. That means you're not really going to have an income to try to make these payments, okay? So that's some of those things. And not only that, but you have to, for example, you might not have childcare if you have other children that are involved in this. And so, you have to take off time for that or pay for childcare so that you can actually spend time at the hospital, things like that. There's less income. There's very little ability for a lot of these parents to pay in situations like these. You're in an awful situation, and here Ron DeSantis is saying, we're going to make it worse for you. You entitled parents, you're just trying to get freebies from the state. No, we're going to save money. Because, we got some rich donor friends I want to pay off. For giving me campaign contributions, you know what I'm saying? Sickening. Look, these parents are trying to keep their kids alive. I mean, why are there even premiums in the first place? Florida is one of the, very few states that actually charge you premiums. The whole point, though, of Medicaid is that you're literally too poor to pay the premiums. And the kids program is, hey, we don't want to punish the children for the parents not having enough money to get traditional health care. But apparently, once again, they don't care about that. But getting to the stat here, Florida is just one of 9 states that charges premiums to children below 150% of the poverty line. So, yeah, charging some pretty poor kids money, to live. Now, it gets worse, though. You combine this with Florida's 6-week abortion ban that is about to come into effect, and you have major hypocrisy on your hands. Not that they care about it. We're going to force you to have this baby. Oh, and if there are issues here and you can't afford to pay a premium for that child's health insurance, well, we're just going to let you die. We're going to let the kid die, I should say. You're, sad day for you. You're on your own. We're going to rip healthcare right away from you. You know what this is? This is nothing more than a punishment for poverty. And a means, of course, to control women, as usual. These right-wingers, they love to talk about saving the babies. Saving the babies, got to save the babies. While, in practice, ensuring that children that are born do not get proper food or health care. Their movement is nothing more than save them in the womb now so we can starve them later.